Hi friends, I am Dr. Dattaram. I am a surgical gastroenterologist and a laparoscopic surgeon at Sunshine Hospital, Hyderabad. Today I am going to talk about some of the common concerns about recovery from a hernia surgery. Most of the patients are really concerned and worried about the recovery, the kind of recovery, like how long they are going to stay in the hospital and when can they resume their physical activities, when can they go back to office, when can they drive the car, etc., and when can they resume their gym, weight training, etc. In most of the cases, the recovery after hernia surgery is very simple and straightforward. First and foremost, most of the patients think that they need to be confined to bed after surgery. So there is no need to be confined to the bed or prolonged bed rest after hernia surgery. So from day one, that is from the day of surgery, you are encouraged to get up and walk and ambulate as soon as possible after the surgery. Early ambulation has many benefits. So by early ambulation, the blood circulation in the lower limbs is better, and this prevents clotting of blood in the lower limbs. It's called as deep vein thrombosis, which can embolize, which can go to the lungs and cause problems. So early ambulation decreases the chances of deep vein thrombosis and the sequelae. Not only that, even early ambulation also helps in improving the lung function. It decreases the risk of pulmonary complications. This is especially helpful in elderly patients, on patients who smoke, who have been smoking, etc. Early ambulation also help improves your bowel function. You will be able to pass motion early. So it also has a lot of psychological benefits. You will feel better and pain gets adapted faster. Second most important thing people would like to know is when can they start their routine activities. So by 3 to 4 days, once the pain has reduced and you are comfortable moving around, you can start your daily routine at work. Like say at home, you can start cooking. You can move around in the house. You can climb the stairs. You can climb down the stairs, etc. Generally, by 1 week's time, you will be able to go back to your office. Regarding driving the car, once you are confident and the pain has come down by a week's time, you can actually drive your car on your own. Even bike, I advise patients not to use a kick start. You can start your bike using the push button or the push start button. That is better. Coming to walking, a lot of people are health conscious and they would like to go for a morning walk. I would say by 1 week's time, once you are comfortable, once the wound also has healed a bit, and you are also pain free, then you can start your routine morning walk. Coming to strenuous physical activities like which involve stretching of the abdominal muscles. These things like weight training or going to the gym, brisk walking, running, sports, swimming, all these things, I generally recommend a period of some time. I always recommend patients to abstain from these things for at least 12 weeks after a laparoscopic procedure. If it is an open or hernia repair, then at least 16 weeks. If the hernia has been a complex one, if you have undergone surgery for a large hernia or you had multiple recurrences in the past, in such situations, much longer period, I would say some 6 months to 8 months, you abstain from all these strenuous physical activities. This is my practice, what I suggest my patients, especially who have complex hernia repair. For a simple, straightforward laparoscopic inguinal hernia repair, by the end of 3 months, that is 12 weeks, you can as well resume normal life. That is, you can go to gym, you can start doing all complex yoga postures, you can as well go for swimming, etc. For complex hernia repairs, if you have undergone a complex hernia repair like a large ventral hernia or multiple recurrent hernias in the past, in such situations, I would definitely advise you to take a longer period of rest. So any activity which will stretch the abdominal wall muscles, which puts strain on your repair. So if you stretch early after surgery, there is a risk or a chance of early recurrence after surgery. So to prevent recurrence, generally I advise after a straightforward laparoscopic hernia repair for 12 weeks, if it is an open repair for 16 weeks, and if it is a complex hernia repair, definitely up to 6 months. Coming to the wound, a lot of patients have concerns about the wound care. If it is a laparoscopic hernia repair, by 3 to 4 days you can actually remove the dressing and take a shower, and you don't require a dressing thereafter, because the wounds made after laparoscopic procedure are very small. They are generally 5 millimeters to 10 millimeters, that is not more than a centimeter. These wounds heal very fast and the risk of wound infection is very less, and you don't need a dressing after 3 to 4 days. So you can keep the wound open and take a shower. If it is an open procedure, even then after 3 to 4 days, once the pain has come down, you can actually remove the dressing and take a shower. But many patients are really concerned and worried about leaving the wound open. So in such patients, you can actually keep the dressing till the sutures are removed. You can have 1 or 2 dressing changes in between. Next important things patients have to know is signs of wound infection. New onset pain or worsening of pain after surgery, if there is swelling at the wound site, if the wound becomes red, and if there is any discharge, especially purulent or pus discharge from the wound, or if you are running fever, these are the few things which are suggestive of a wound infection. So in this, if any of these things is there, you need to go back to your surgeon, consult him, let him examine the wound. So you may have to let out 1 or 2 sutures and let out the fluid from the wound. In such situations, you may have to take a swab for culture and sensitivity. The surgeon may actually let out the collection if there is any, and then you may have frequent dressings. So you may also have to take some antibiotics for some time. Coming to diet after hernia surgery, next important thing is the diet. So regarding diets, a lot of patients assume many things and they think that they are not supposed to eat certain foods. So after hernia surgery, there is no diet restriction. You can eat whatever you want. So all that you need to take care is you take adequate protein and fiber. Protein actually helps in faster healing of the wound and strengthening of the wound. And so you need to take at least 60 grams of protein in a day, and fiber at least 30 to 40 grams of fiber in a day, which will ensure that you have a smooth bowel movement. Other important question patients ask me is whether they can use a Indian toilet or Western is preferred. So I would say that you can use whatever toilet you have at home. You can either use a Western toilet or an Indian toilet. For laparoscopic procedures, it is very simple. You can use either of them. Squatting doesn't affect the wound or the mesh. If it is an open procedure, generally using an Indian toilet is little cumbersome. So I would say a Western toilet is preferred if you have had an open surgery. So you can use even if you don't have a Western toilet, you can also use a modified chairs for that. Irrespective of the hernia repair, you can either use an Indian or a Western toilet. There is no specific recommendation for that. Thank you so much. I am Dr. Dattaram. I am a surgical gastroenterologist and a laparoscopic surgeon at Sunshine Hospital, Hyderabad. If you have any queries, you can always write in the comment section. Thank you so much.